it was challenging. We were playing with a lot of odds, and we were working with a lot of challenges. And the fact that we got it started was almost a miracle.
They had a little modular unit on Berlin Street where they delivered health care. And now look at us today, 40 years later, in a state-of-the-art facility, having 2 locations and having served the community for 40 years. And it went back to a kitchen table of some advocates in the community, and they're not feeling served by, at that time, the present medical community. You know, they were told or basically made to feel that they only could go to like a health department or somewhere and be seen by a mid-level individual, but not by an actual physician.
I was over at the University of Georgia Student Health, and I heard about the group of people here. It was in those days, it was called Model Cities Health Clinic. And it was a part of the government program at that time of going around and going into neighborhoods and trying to revitalize, and they were putting money into public housing and revitalizing neighborhoods and trying to support small businesses. And so part of that was to develop a Model Cities Health program. Now, you know how the government works. It doesn't.
You had several people who just said, well, no, we deserve this and we're going to go after it.
The mission of the Athens Neighborhood Health Center hasn't changed. We are here to provide high quality and compassionate primary health care to anyone who seeks our services. We have a special mission to care for those who happen to be underserved in our community.
For the people that don't have health care and insurance, you know, it's very helpful.
Well, I came to Athens Neighborhood Health Center 24 years ago with the National Health Service Corps obligation. It has been rewarding to be able to place people on a sliding fee scale and provide full, comprehensive primary health care.
He's been through 2 heart surgeries with him. He had his last one in 2009, and she was right there. And I couldn't ask for a better doctor.
We have a second site we call our East Athens Satellite Facility that sits in the Miriam Moore Community Service Center. My vision is to see this community effort continue to be a vital part of the healthcare delivery in Athens Clarke County. For that to happen, we will need improved support from other entities like our hospitals, and definitely with the University of Georgia and the medical partnership. There will have to be a better collaboration and support of the services, both on our end and theirs. There has to be a respect for the needs of the community in order for that to happen. And I am hopeful that, that these relationships will continue to build and grow.
After 40 years, still excited, still much work to be done, but we are not going to tire in well-doing.